Yeah. Dr. Chris, can you hear me?
Yes, I can.
Awesome. Wow. Once again, thank you so much for taking time off your busy schedule to be with us this evening. I really appreciate that. And as I said, I think folks would be joining in, as we move along. So to respect everyone's time, I'm just gonna dive into it and then have this wonderful discussion today. So before I start off, I would like to introduce Dr. Prince. Dr. Prince is a lecturer and a clinical psychologist and a health behavior scientist. He holds a PhD in behavioral sciences in relation to medicine from the University of Newcastle in Australia. Prior to commencing his PhD, Dr. Prince completed a Master's of Philosophy degree in clinical psychology with the University of Ghana, Legon, and a Bachelor's of Science in Psychology with the University of Cape Coast. So Dr. Prince, we are so humbled and honored to have you on this platform today and looking forward to a very insightful, conversation about how mental health impacts our physical well-being. So yeah.
Thank you so much.
My pleasure.
Thank you so much for the opportunity, and yeah, it's a privilege to be here to share the little that I know.
Awesome. And thank you so much. And so this month has been the Mental Health Awareness Month. So we've been having, a lot of mental health educational series on different mental health topics. And just briefly, my name is Osei, the founder of OKB Hope Foundation, and we are really committed in bringing, healthcare to underserved and rural communities. And through our work, we've really realized that, physical health and mental health are definitely interrelated. To each other. You cannot treat physical health and leave out mental health. And so, this topic is a very sort of wonderful, intersection where we are going to learn about how your mental health impacts your physical well-being. So I guess to dive into the questions that we have, I guess one of my main questions is like, how do you believe mental health and physical health are interconnected? And if so, can you provide us with some examples of how these two sort of separate, entities or like healthcare situations are connected?
Okay, yeah, thank you very much once again for the opportunity. So I will start by saying that indeed physical health and mental health are interrelated. They are connected. There's a strong link, or there's a strong relationship between physical health and mental health. And if we are familiar with the definition of health according to the World Health Organization, they define health as a complete state, or a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So the WHO, that is the World Health Organization, the international body that all countries are affiliated to and take instructions from, and other things related to health from, consider health, or when they say someone is healthy, it means the person is both physically, mentally, and socially fit. Okay, so there's that holistic approach to health. But oftentimes when we say someone is healthy, our mind goes to the physical. Okay, we don't, especially in our part of the world, in Ghana, where when we say someone is healthy, our emphasis is just on the physical. We don't consider the mental aspect. We place very little emphasis on the mental aspect of health, and then also even the social aspect as well. So there is, like I said earlier, there is a strong connection or relationship between physical health and mental health, in the sense that our physical health, so the relationship is bidirectional. When I say bidirectional, what it means is that the physical health can influence your mental health, and then your mental health can also influence your physical health. So let's take, for example, physical health influencing mental health. So if someone has a chronic condition or has been diagnosed with a particular condition, For example, if someone along the line gets a diagnosis of cancer, that is a physical health condition. And so the person is likely to experience some psychological distress because of their physical condition. So they may be like they may begin to have symptoms of depression. They become excessively worried. They may, have even become suicidal as well because of the physical condition that they have. So that is an example of physical condition influencing mental health. Okay, and even when you take physical disability, okay, when people who are physically disabled or who have some physical impairment, it can also influence their mental health in the sense that they may not be happy with how they appear in terms of in body wise, and so they may experience some depression or anxiety or any mental health condition. Then we also have mental health conditions that influencing physical health as well. And an example may be, for example, if someone has a mental health condition of schizophrenia, they are usually put on medication, and some of the medications that they take tend to impact, for example, their weight. So they gain some additional weight. It might also affect their sleep pattern and even their eating pattern as well. So in that case, we've seen, when you look at the literature or the studies, we've seen some mental health patients developing physical health problems as a result of the mental health condition. So before their mental health problems, they didn't have any physical problem, but as a result of their mental health condition and then the medication that they are on, or as a result of certain things that is happening when it comes to their mental health, it tends to affect their physical health. So we've seen mental health patients having issues with their cardiovascular system, so they become hypertensive, whereas originally they were not hypertensive. Some may even end up having diagnosis of diabetes as a result of other things happening in their body. So that is an example of mental health influencing physical health. Okay, and we've also seen some people, not coping well as a result of their physical condition, and so again, their mental health is impacted. So, like I said, there is a strong relationship, and that relationship is bi-directional. And there's this popular Latin saying, I'll say it in English because I don't speak Latin. That says that a sound mind lives in a healthy body, or for you to have a sound mind, or for you to have a healthy body, you need to have a sound mind. So again, that sort of reinforces the relationship or the connection between physical health and mental health.
All right. Thank you so much for the wonderful overview and the explanation and also the examples. I know that, you mentioned some about like how people would take medication that would influence their weight gain. So I'm just curious about so what are some common sort of physical symptoms or conditions that can be influenced by mental health issues?
So an example is what I mentioned earlier, cancer. So cancer, diabetes, hypertension, chronic obstructive conditions. So basically, all physical health conditions can, result in an individual, having mental health problems. Okay, and I just also want to put it out there that when we say mental health challenges or mental health problems, it comes in. People usually think, okay, when we say someone has a mental health challenge, then it's the severe one, but it comes in different levels. We have mild, moderate, severe, okay, and you may also want to say very severe conditions. So it doesn't matter what physical condition. Somebody may even have malaria, and to surprise you or to interest you to know that they may have some mental health challenge. So certain thoughts may be running through their mind, and that can influence how they behave. They might be thinking, oh, maybe I'm going to die because of the malaria. And so certain things that they do or certain things that they say would then, show that they are having some mental health challenges. It doesn't mean that they have very severe mental health problems, but they are just, beginning to exhibit some mental health challenges or symptoms. So all forms of physical health condition, it can be cancer, it can be diabetes, it can be hypertension, it can even be HIV or AIDS. It can even be Burns-related issues. So all physical health conditions have the potential to impact an individual's mental health condition if the individual is not helped properly or is not taught good coping mechanisms to cope well with their physical condition. They are likely to experience some mental health challenges. Yeah.
Wow. Yeah, that is very interesting because it is now making me think that, like, for every physical, like if anyone goes in for, like, let's say a physical, checkup, they probably need to also do a mental checkup because of how definitely closely they are related. Because maybe if someone has this physical condition, the probability is that, probably they might be having some thoughts that might also sort of end up being a mental health challenge. Wow. Thank you so much for that explanation. And I know that in our part of the world, definitely there's a lot of stigma surrounding mental health and people's ability to, speak up and go and seek mental health assistance if needed. So with that being said, like, how might you sort of think that, how do you think this stigma, affects individual willingness to, seek even, physical health if they know that the mental health is causing that situation?
So stigma is a big thing, especially in our part of the world. And in the Western countries, it used to be like that many, many years ago, but things have gotten better along the line. People have now begun to realize that, mental health condition is, if someone has a mental health condition, it's the same as having a physical health condition. Even though we know that having mental health conditions comes with some challenges that physical health conditions may not come with, they have come to understand that it's just like you having a physical health condition. And so there's no point in they stigmatizing people with mental health condition, or there's no point in treating people with mental health conditions differently from people with physical health conditions. So stigma is a big thing, and it impacts or it affects so many things. When people stigmatize those with mental health conditions, it affects them in many ways. Okay, so people are easily denied of jobs because of their mental health conditions. They are not able to take certain courses, or they are not able to study in school because of the stigma. Some are not able to even find a suitable partner because of the condition that they have. So stigma really impacts a lot, and it also affects treatment seeking. So when people know that they are going to be stigmatized, they won't disclose their mental health condition. And so they are also not likely to seek for treatment. They are not open about it. And so they end up, keeping it to themselves. Their family members also do not open up on it. And so the person, it worsens, the condition worsens. Okay. I think in Akan, there's a saying that the one who sells his or her sickness is the one who gets medication or treatment for it. So if you keep quiet because of the stigma, you end up not getting the proper care that is required. Okay, so I remember, I think somewhere in 2015, when we had the flood and fire disaster in Ghana at Cycle after the rainfall. We went there to provide psychological support to the victims. And when we did brief assessments, and we're referring the people to either Korle Bu or Accra Psychiatric Hospital. And we realized that people who were being referred, some people who were being referred to Accra psychiatric hospitals were rejecting it. Okay, not that they didn't want to seek for further support or treatment, but they were rejecting it. And it's because of the perception that comes with going into a psychiatric hospital. What will people think if they see me entering a psychiatric hospital? What will someone think if he sees me or she sees me walking out of a psychiatric hospital? Maybe I might end up seeing someone I know there. So what would a person think of me? So they were rejecting it, whereas they prefer to rather walk into Korle Bu because that is a general hospital. And so when you are seen coming out of Korle Bu, it's okay. Like people, okay, what did you go and do? That? Just wait for normal checkup or something. And for that one, it's fine. But when it comes to mental health condition, people shy away from it. So that is an example of how stigma impacts people's treatment seeking behavior. And like I said earlier, once the person doesn't open up, okay, and again, we've also consistently heard people saying that, oh, I don't know where the psychologists are. I don't know where the psychiatrists are. And I always say that when it comes to physical health problems, even if they have to go underground to go and seek for treatment, they will do that. Okay, usually when someone has a physical problem, they will make all the inquiries. Where can I find this specialist? Like we always ask, where is the best consultant, or where is the best person who can, help me deal with this problem? And even if they have to travel all the way from wherever, sometimes people even travel overseas to go and seek the best treatment. But when it comes to psychological or mental health problems, the excuse are, oh, I don't know where they are. Where can I find one and all that? And again, that is because of, and a possible reason for that is the stigma. People do not want to be open about their mental health problems. And so they sort of end up saying that they are not able to access the services of psychologists and all that. So I think it's really important that we educate people, like, for example, what we are doing this evening, and then also, keep talking to people, letting them know that mental health conditions are, just as when someone has a mental health condition, it's just like having a physical health condition. There's nothing wrong, or it's not right for us to stigmatize them so that they can easily open up and then seek for treatment as well.
Wow. Yeah, definitely agree with you on that. And it has been definitely a challenge, even through the work that we've been doing, even going to high schools and speaking with students, like they are still sort of not forthcoming or don't want anyone to know that they're going through that. And like some of the situations that we encountered definitely was, was very serious. Like we were really surprised that they were keeping it to themselves, but some don't feel really comfortable going to their counselors. So I know that there's a lot of work to be done to, especially destigmatize, mental health, especially in our world, in terms of all the cultural factors that plays a role. But I guess we will take it one step at a time, definitely. So I wanted to, I'm now jumping because I know that, lifestyle choices, lifestyle factors, also contribute both to, mental health well-being and physical health well-being. And I wanted to know from your perspective, can you talk a little bit about the role of lifestyle, factors such as maybe diet, exercise, sleep, in both, physical and mental health, and how that sort of contribute to the overall well-being, of a person or individual?
Thank you so much. So, lifestyle it's not a big thing. And when you look at the data, about 71% of people globally die from non-communicable diseases. And at the root cause of non-communicable diseases, cancer, diabetes, chronic kidney diseases, hypertension, and so many of them. These are examples of non-communicable diseases. And when you look at the data from WHO, about 71% of people globally die from non-communicable diseases. And at the root cause of this non-communicable diseases are lifestyle factors such as poor diet, smoking of tobacco, alcohol consumption, physical inactivity, sleep problems, and assuming that drinking of carbonated soft drinks and other factors. So it's a big thing now, and unlike in the past when the emphasis was more on communicable diseases. These days, like I mentioned, it's not a big thing. A lot of people are fortunately losing their lives as a result of that. And again, we've seen some connections or links between these lifestyle factors and mental health. Okay, so the relationship again can be bi-directional in the sense that people, when they go through some challenges, okay, they are not able to cope very well. So the coping mechanisms that they adopt are not adaptive. Unfortunately, they adopt maladaptive coping mechanisms. So they may end up, for example, smoking or drinking alcohol as a way of coping with the challenges that they are going through. And then that can impact on their mental health, and then can also end up affecting their physical health as well, because alcohol can impair your sense of judgment and can impact on how you think, your perceptions and all that. And along the line, it might, result in you becoming delusional or experience hallucinations and all that. And that might result in diagnosis of schizophrenia or some severe forms of mental health disorders. The same as smoking as well. Okay. And then, so that is an example of how these lifestyle factors tend to impact for environment. So when you take physical activity as well, engaging in physical activity helps us a lot, both physically and mentally. Okay, you realize that if you consistently engage in physical activity, you feel very good. Okay, but if you don't engage in physical activity, your mental health is not really good. The same thing for physical health as well. You realize that body-wise, you are not okay, but if you engage in good physical activity, you realize that you feel good in yourself. And it's because when we exercise, some hormones are released into the brain, and that makes us feel very good about ourselves. And so again, when you look at the literature, physical activity has been found to people who engage in physical activity are less likely to report having depression. Okay, because when we exercise, certain hormones, like I mentioned, the endorphin hormone is released into the brain, and that makes us feel good about ourselves. So in some parts of the world, lifestyle prescription is not a big thing. So psychologists, psychiatrists, doctors, medical doctors are prescribing physical activity for patients with some mental health conditions. Okay, because they realize that there is a connection between that. And then also when it comes to diet as well, okay, when it comes to diet, there is also a connection between that and mental health. Because when you eat a good meal or a balanced meal, it has all the ingredients, it has all the nutrients in there that are good for the body. And so that also tends to impact on how you feel. So if you eat junk foods, okay, you eat the fries, the burgers, you drink a lot of carbonated soft drinks instead of drinking water or taking something that is healthy, you end up gaining more weight. And then as a result of the weight that you gain, and because you are not exercising to burn the excess fat, you don't feel good about yourself. You are not happy with how you appear. And so psychologically, you are not happy with how you appear. And if you find yourself in a culture where people, tease people because of their body weight and all that, that can impact your mental health. And unfortunately, in our parts of the world, we are beginning to see childhood obesity amongst children, because parents these days think that it is fun to buy KFC for. I remember when we were growing up, KFC was not something, I don't remember ever seeing KFC in Ghana, when I was growing up. but now it's everywhere. When you drive around, you see them. Then we also have other, fast foods joints and all that around. And so children are eating this. The parents think that it is fun to eat these things, so they buy them for their children, and then the children eat these things. And I realized that with those things, it can be very addictive as well. And so once you start eating it, you crave for more. And, it's also the spices and those things that they put into them. It becomes very addictive. So you desire for more. So you want to eat them more. And then the children eat it. Then they begin to put on weight. They go to school, their colleagues start, laughing at them. They tag them with below and all sorts of things. And then it begins to impact on their mental health. And if for the ladies, they might begin to, in our culture again, we consider ladies who are, slim, or not that fat as the standard body. And so we might end up having some of them, maybe developing like eating disorders. Okay, they may, begin to have what we call the binge eating disorders, and as a result of the desire to have a body that is appealing to the public. And so that is an example of how not eating healthy meals can impact on the physical health, and then to also then impact on the mental health. So there is actually a connection. And like I said earlier, we have a big movement called the lifestyle medicine movement, where they are encouraging that people take care of themselves by, not engaging in health risk behaviors. So, socializing with people, being in the natural environment. If you live at a place where you have more natural environment, as in trees and all that, can go for walks and all that. So we've seen those things being prescribed for mental health patients, and not just medication, because again, there are side effects of these medications. Like I mentioned earlier when we started, some of the medications that are prescribed for people with mental health conditions comes with some effects, or some begin to gain weight, and because they do not want to gain weight so that people would laugh at them or some other reasons, they sometimes do not comply with the medication, or they do not adhere to treatment. And so tends to affect their recovery rates. They are not able to recover quickly, or it rather makes the condition very worse. So we are now advocating that aside the medication, people should also be encouraged to exercise more, eat healthy. If they are consuming alcohol, they stop. If they are smoking, they quit smoking, so that they can recover and then stay healthy, and then they can then function effectively, or their quality of life will then be improved. Yeah.
Wow. That is amazing, and I agree with you. Definitely, there's been a lot of, lifestyle changes. Because right now there's a lot of fast food. People are now, going to those fast foods rather than eating like the local meals. And also very interesting on how, in the long run, it affects mental health, because I like the way that you explained that people will eat fast food right now, and then once they gain weight, then go to school, people start laughing at them, and that leads to like mental health, situations. But wow. So, we're really interested in what you talked about, the lifestyle medicine. I guess I would love to, I guess that could be something that we can touch base later on, but it's very interesting. And in our type of, our part of the world where we don't even have a lot of, physicians or even limited facilities, I feel like we should even prioritize more of the lifestyle medicine than waiting to get sick before we go to the hospital. But thank you so much for touching on that. And my next question kind of relate to what we previously discussed, and which is related to stress. I know that right now with the economy and how things are going, like people are really stressful, right? People don't have jobs, like thinking about like where's my next meal coming from? All these cause a lot of stress, right? So I wanted to know, like, how does chronic sort of stress impact the body, impacts the overall health, and what strategies can people or individuals employ to better manage stress? Because it's something that we can prevent, But I mean, if there are any ways that people can employ to manage all this, stress.
So yeah, stress, I like how you said that stress is not something we can actually prevent, because we also know that some amount of stress is good for us. A certain level of stress is good to keep us going, to keep us motivated and energized, to wake up from our bed every morning to go looking for our daily bread. Or if you're a student, some amount of stress is helpful for you to study. And even among sports people, they also are sometimes, put under a bit of stress to help them stay on top of what they are doing. So stress is part of our daily life. Okay, when it becomes very excessive, okay, or when it becomes chronic, then that is when it tends to impact on our health. Okay, so it can affect our physical health. It can also affect our mental health. That is, if we don't cope properly, if we are not using the appropriate coping mechanisms, it tends to impact on our physical health and our mental health. Often when people are stressed, it's because there is, they feel a bit overwhelmed. Okay, there is something that they are experiencing that they feel overwhelmed. And so and then the resources that they have to deal with that thing, the challenges that they are encountering, is not adequate enough, or it's not there. So they feel overwhelmed, and that results in the experiencing stress. And some of the physical challenges that people can even become a bit irritable or excessively irritable. They get angry quickly because they are stressed. They may also have problems with their heart rates. Okay, so either the heart rate shoots up excessively, and then we find some people may even have problems with their heart. Okay, so cardiovascular condition, or they may become hypertensive as a result of the stress that they are experiencing. And biologically, there's a hormone in our body. God in his own wisdom has put certain hormones in our bodies. Okay, so an example of this hormone is cortisol. So cortisol is a hormone in our body. It has its role. And when we become excessively stressed, or when we experience chronic stress, these cortisol hormones are released into our bloodstreams. Okay, then they tend to fight the immune system. And what happens is that when the immune system breaks down, we know we become vulnerable to any either virus or germs or anything that finds its way into our body. And I don't know about our listeners and our viewers, but personally, when I experience, for example, if I don't have adequate sleep because I have so much to do and I don't sleep very well, I realize that I begin to have cold. Okay, common cold, okay, or flu. Okay, and usually when you have common cold or flu, it's because there is like a breakdown in your immune system, and you have not been able to fight, the immune system has not been able to fight whatever it is that has entered into your body. And so that makes you develop cold. Okay, and so when you have cold, one of the things they will ask you to do is to drink a lot of water and then rest. Okay, if you have enough rest, it gets better with time. So when we become excessively stressed, okay, this hormone is released into our bloodstream. The cortisol hormone is released into our bloodstream. It breaks down the immune system. And then once the immune system is broken down, anything that comes into the foreign body, that comes into the body is, you become vulnerable, and so you can easily become, sick. And then that will also then impact on your physical health. So it's very important that we cope very well. And we all have different ways that we cope, okay, when we become stressed. For some people, listening to music is something that will calm them down. Okay, that will make them feel relaxed. Okay, other people, it is going for a walk or, engaging in physical activity is what make them calm down and then deal with the stress. For other people, it's maybe speaking to someone that they trust, Okay, and then the person, sometimes they don't even need a solution to whatever challenge, but just speaking to someone about it, makes them feel relaxed. Okay, so those are some of the ways that for other people, it might even be just journaling or writing down whatever it is that they are going through. Other people too, it might be sleep. Okay, they just sleep, they wake up, they are fine, their minds are, their brains are clear, and then they are able to deal with whatever it is that they are going through. Okay, unfortunately, there are some people who don't cope very well. So, for example, they may resort to the use of alcohol. Other people resort to the use of other substances like drugs. Okay, they may smoke or inject other substances into their bodies as a way of coping. But those, usually when you drink the alcohol or you smoke, it makes you feel good. People will say when you drink the alcohol, you forget your problems, but you realize that you wake up and then the problem is staring in your face. You've not really dealt with the root cause of the problem. You are rather just trying to cover up. Okay. And if you're not lucky, you may end up becoming addicted to the substances. Okay. And so the problem has not been solved. And then you also become addicted. Then you now have to deal with the addiction. And, once addicted to substances can also end up resulting in the individual having some mental health conditions. So those ways of dealing with challenges, smoking, drinking of alcohol, or doing some other things that some people, they even cope by gambling. Okay, so they gamble and that makes them feel relief. But again, we know that gambling is very addictive. You end up wasting all your, the inadequate resource or money that you have to gamble, and you don't have anything to eat. Then you lose all your resources. Then you begin to become worried, to anxiety. That can again impact on your physical health. You may end up having hypertension as a result of you being a constantly anxious. You are the type that becomes anxious. Where is my next meal going to come from? What is likely to happen to me in the next 5 years if I'm not able to get a job and all that? So it's very appropriate, or it's very important that we cope very well when we encounter stress. If we realize that it is becoming chronic, the psychologists that are available, they are there to help you. And so you can seek for the services of a psychologist to help you if you realize that you are not coping very well, or it's affecting other aspects of your life as well.
Wow. Yeah, that was a very great explanation on how the stress can affect both the physical and the mental well-being of an individual. But I'm just curious, so in terms of if we leave this untreated, what are some of the long-term impact on both mental health and our physical health? For example, if people have stress or depressed or anxious and they leave all these conditions untreated, how does it have a longer term impact on the overall individual's well-being?
If they are not treated, the quality of life is going to be impacted. Okay, everyone's desire is to live long and enjoy whatever they are working for, and if it is helping other people, the desire is to live long, to continue helping people and all that. So if someone has a mental health condition like depression or anxiety or schizophrenia or post-traumatic stress disorder, obsessive compulsive disorder, and they do not open up because of stigma or the fear of being, labeled or judged, and they keep it to themselves, they are likely to not live. It impacts their quality of life. If they don't die prematurely, they may live long, but then that impacts on their quality of life. It can also impact on their productivity. So people will begin to realize that it seems there is something wrong with this person, but you are not really sure what the problem is. So you go to work and you are not functioning well. Okay, and nobody really knows what is happening to you, but you as the individual, you know that all is not well. But because you do not want to open up and tell people or to seek for help, you keep quiet about it. You might be laid off from work. You go get another job, and then it continues that way. So within a year or two, you've been laid off more like 10 times or something. So it doesn't, it affects your productivity, your quality of life is going to be impacted. So the earlier the individual sticks for treatment, the better. Okay. Even the same for physical conditions. If you don't stick for treatment early and it gets to a state where it becomes very difficult, the health professionals can only do very little about the situation. Okay. But if it is detected very quickly, and then you go to the hospital on time, and then they are able to, assess you and then start treatment early, you realize that the prognosis or the outcome becomes it's better. Like you're able to, it's your quality of life, and then you're able to live longer. But if you keep quiet about it and it gets worse, like there's nothing they can do about it. So it's the same thing for mental health as well. We encourage people. People don't go for mental health checkup, unlike we do for physical health checkup. Okay, so I also want to encourage that we should, have that desire to seek for mental health checkup once when we go for our physical health checkup in a year. We should also check to see if everything is all right. Okay, so that if there is something that is not right, it can be detected very early, and then treatment can be started early, and then that will then result in you functioning properly as a person, and you can live long to enjoy whatever you are working for, and also to help other people as well. Yeah.
Thank you so much for the wonderful explanation on the long-term effect or impact on both physical and mental health when we leave things untreated. Definitely, the quality of life and the productivity really in the long term impacts us economically, and even like especially if you are breadwinners, like people that are dependent on us to get affected. So it's this whole long chain of like things that can happen if we don't take good care of our mental and physical health. And definitely I envision a world where like people can now work into a hospital or work into a psychologist or psychiatric office just for a mental health checkup. I guess that would be great, and hopefully we can get to that point where there's no stigma. People can just walk here and say, like, you know what, I want to really check how I'm doing mentally. So thank you so much for the wonderful explanation. And I have my last question for discussion, and really want to end on the note on like what are some preventative measures that as individuals we can take to ensure that we are functioning optimally both physically and mentally.
Thanks for the question. So for physically, we have what we call the preventive medicine. So by preventive medicine, what we mean is that you are taking certain steps or actions to prevent you from getting certain, conditions. Okay, so again, that is where lifestyle medicine also falls under, where, exercising, we are encouraged, according to the World Health Organization, as adults, we are supposed to engage in at most between 75 minutes to 150 minutes of physical activity, vigorous physical activity every week. Okay, so if we do that consistently, it prevents us from developing certain physical condition. Okay, and also it tends to improve our mental health as well. I realized days that I exercise, I feel very okay, both body-wise and then mentally. But when I realized that, okay, I get very busy after being able to exercise enough, you realize that you're not that active, okay, body-wise, and then mentally. So physical activity plays a big role when it comes to preventing us from developing certain chronic conditions. Again, eating well as well. Okay. Unfortunately, there's so many junk foods that are available these days. They are fast, easy to get, so we tend to rely on them, and so we are not able to eat. Again, the WHO recommends that we eat enough fruits and vegetables. So at least 400 grams of vegetables and fruits every day. It's a lot, but if we are if you are not able to meet that 400 grams every day, if we are constantly eating food, they say an apple a day keeps you away from the doctor. So even if it is eating small fruits a day, and having vegetables in your meal, okay, again, that will also result in you staying physically healthy, and then that will also have a result on or an impact on your mental health, because if you stay physically healthy, you don't develop chronic conditions, okay, either now or in the future. You don't have anything to worry about, okay. But if you don't stay physically healthy, and then you have chronic conditions like diabetes, you are worried, hey, am I going to die? If you have not been able to save enough money for your pension, then it becomes a challenge as well. So all those things, you begin to think about them, and then that will have more impact on your physical health and then your mental health as well. So eating well, not consuming alcohol, not smoking, okay, not smoking, because if you smoke and drink alcohol, it's not just only impacts on your physical health, but you can maybe become addicted to it, and it can affect your mental health as well. And also having adequate sleep, okay, having adequate sleep. Unfortunately, because of how busy everyone has become, and in our parts of the world, even in the Western world too, people have challenges with their sleep, even though they may not have, serious traffic like we do here, but people stay far away from where they work. So they have to wake up very early to either catch the train or to drive, or they have to do multiple jobs in order to stay on top and pay their mortgages, or, do other things that requires a lot of money to do. So people are not having adequate sleep, and that again can impact on our physical health, and then that may also impact on our mental. So we become easily irritable because we are not sleeping well, and so the little things, we become angry, and then we can easily burst out, and we might end up hurting ourselves or hurting other people. So adequate sleep is very important. And once we are able to sleep very well, we don't, end up having some physical conditions that will then impact on our mental health. So it's more of the preventive medicine thing, lifestyle factors, exercising, eating well, not smoking, not drinking, sleeping well, and taking good care of ourselves. And I believe that's will be fine. And so, like we've mentioned earlier, it's very important that when we detect something, we shouldn't wait to say, oh, maybe I'll be fine. The moment you detect something and you realize that all is not fine or well, it's very important that we go and do a checkup, and then see if everything is okay. If it is detected early and it is prevented or stopped early, then it helps in so many ways. Yeah.
Wow. Yeah, thank you so much. Sounds to me like, the solution that would work for physical health ultimately, works, for mental health as well. And that also sort of double, what's it called? So that also sort of confirms that, like mental health and physical health are not separate things, but they are really, closely, interrelated, or, there's a relationship, between physical health and mental health, and one of the other can impact each other. So, thank you so much for this insightful discussion and conversation about, how mental health impacts physical well-being. I know that we are very close to time, so I would like to once again thank you so much. I mean, for your time and for being here to really educate us about the physical and mental health. And for me, the key takeaway is that prevention is better than cure. It's very important. I mean, for us to modify our lifestyle choices or seek to choose lifestyle factors that would prevent us from getting sick, like eating healthy, exercising, and making sure that we have a very great supportive and social group, to support us. So, thank you so much, for this insightful conversation. I don't know if you have any last words before, we bring this insightful discussion to a wonderful close.
So I think the last word will be to say thank you for the opportunity, and I've seen a few pictures of what you are doing, what your foundation is doing. So just want to commend you and to say keep doing your best. It's not easy, especially when you want to do advocacy in the area of mental health, because people don't. It's not something that is easily accepted. Like the emphasis is always on the physical and very little on the mental health. So people don't really understand why or what you are doing. But when we keep pushing, I believe that with time we'll get there where people will be. So keep doing your best, especially with the senior high school initiative thing. I think to get the message at that stage in life, it stays with them. And so by the time they come to the university, for now, you may not really see the impact, but with time, begin to have a lot more people who understand what it is to have mental health problems and where they can get help from and all that. So keep doing your best, and thanks so much for the opportunity to educate your audience this evening.
Awesome. Once again, thank you so much, Dr. Prince. And to our audience who were able to join us both on YouTube and on Zoom, thank you all so much for your time. And I hope that you are going to take the knowledge and share this with your friends and share this with your network, so that we are able to also get the word out there to prevent people from going through all these, physical health and mental health challenges. So once again,